Pressing pains. These are only a few examples of how you have to follow. After you have gained a sufficient mastery over the book James Taylor Kent's Lectures on Materia Medica, at least over the 50 often used drugs called polycrests, the most popular drugs. Then you can go in sometimes for a reference work of a book called, this is the name of the book, Sensations as If, that is, as if pressed, as if burnt, as if pierced, as if ants were crawling, like this. Then he gives the group of drugs, 4 or 5, that are to be expected under each heading. No, not Kent. I don't exactly remember the author, but it is a wonderful book. It is a famous book, of course. And after using for 5 or 6 years this book successfully and felt that you are benefited by it, then read the 3 articles of Kent on how to use my repertory. Kent has written 3 articles upon this subject. You will find this in the volume called The Lesser Writings of Kent. These articles. You know that the wonderful miracle book called Repertory is composed by Kent through a period of 30 years. And his wife worked with him night and day through the 30 years. And Kent died without completing it. And his wife, with the help of his closest disciples, worked for 6 years more and has completed the book. That is how this book is written. It contains not pages and ink, but the very life of Kent, if one can know the value of it. But a very dangerous book to approach in the early stages of homeopathy. It will grossly mislead you into the wrong drug because you don't know how to use it before you have practiced homeopathy on right lines and orthodox lines at least for 7 or 8 years. In the meanwhile, this book Sensations as If will help you. But before reading that book also, you should be a master in at least 50 drugs in Kent's Materia Medica, thorough master. That means even if you dream about these drugs, you should not dream wrongly. You should get only the correct modalities of the drugs, even in a dream. You will get it, not by reading the book many times, but by seeing the patients and then reading the book leisurely. You will remember these books by seeing the patients and offering your time to the service of God in the name of patients and not otherwise. So, to read this and then begin to practice, use his repertory. But for 1 year, you decide the drug for yourself without repertory. First note it down, the probable drug, and then go into the repertory, see if they tally. If they do not tally, depend upon your selection and judge the repertory, because your reference of the repertory is not yet correct. That is how it goes. I know many doctors in the West who refer to the repertory like donkeys and use drugs. They just take a sentence given by the patient, like the whole it, and then they refer it. And they say, here is it. Once a patient said that a village called Foxy is near in Belgium. I think Foxy is in Belgium? In Belgium. A patient narrated that she was suffering, and in the night when she was affected, she was suffering. But her husband reported that she was also suffering while sleeping. Reported. Then a little homeopather has got his Kent's repertory and pointed out legacies. Why, I asked? He says the patient sleeps into aggravation. See how he misleads himself. The wife says that she coughs even before sleep, but the husband reports that she coughs even after sleep. That is her sentence. And the fellow thinks that the lady is coughing in sleep more than what he coughs during awakened state. So it is legacy. So you may spoil the case. And myself and Dr. Pradesh, we both of us asked him to keep quiet. He said, why? Once again you bring the lady here. You brought the lady. We asked her to narrate. She again narrated. She said, I will come any time in the day or night. Then the fellow blinked. That was one of the patients of the two wonderful homeopathic rural doctors, Saraswati and Brahma. You know Saraswati? No. They belong to Swami Sachidananda's ashram. They have started a homeopathic dispensary in Parkseed village for service. And they have their own patients and their own assistants of homeopaths. And the homeopather takes the repertory and says, here is legacy. I asked Brahma not to allow this fellow to suggest drugs, because Brahma can decide the drugs and diagnose in a correct way. He is often misled by the assistant. Please continue. Also find out if possible, the probable timings of the recurrence of suffering, and note it under each item separately. Next item. Enquire under what circumstances the suffering appears and increases. Under what circumstances it is made bearable and decreases and subsides. That is, suppose a fellow has a pain here. If the lady lies on her belly, she finds it better. She may not be able to tell it to you. But you ask her, in what position you feel comfortable? She says, by sleeping on my belly. Water పడుతుంటే అప్పుడు వాళ్ళకి వచ్చినప్పుడు పట్టేసుకుంటాం వచ్చి belly బాగా కొంచెం తగ్గినట్టు మనం ఆలోచిస్తాం. Menstrual colic, for example. And another lady says that I should not move my leg on my back. I should not move this side or that. If I move, means I will die. So much is the pain, she says. So these two are irritants. One is of one side, the other is of the other side. You can come to understand that the lady who sleeps on her belly when there is pain may be under the pioneer group of drugs, that is amelioration by pressure. And the second lady may be under the arnica group of drugs. Any single pressure or touch or sensation to the stomach may aggravate, like that. And sometimes the lady says, presses the pillow to her belly and bends like this. You will select first to find out fluorescent if it controls. If it controls, it will control within seconds. Why fluorescent? It has got the modality of amelioration by bending double. Bending double అంటే ముందు బటన్కి వంగి మూడంకి వేయటం అంటారు. త్రీ లెవెల్ బెండింగ్ డబుల్. ఇంకో ముందు ముందుతే ప్రాణం పోతుంది. ఇలాంటి చక్కగా ఉంటాడు ఇక ఇక అంటే మనం కూడా అన్నాడు వాడి సరిగ్గా ఉంటుంది చెప్పాడు. ఇక 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 అంటే చక్కగా ఉంటుంది. వెళ్ళి ముందుకు వంగితే ప్రాణం పోతుంది. దీనికి ఆపోజిట్ బై బెండింగ్ బ్యాక్. Immediately you try one drug called diasphoria. అంటే ఈ రెండింటికి ఆపోజిట్ మోడల్ డ్రామింగ్ అందుబాటు. ఇది ముందు కొంగికి తగ్గుతుంది, ఇది వెనక్కి కొంగికే తగ్గుతుంది. సమస్య ఒక మాట విశాఖపట్నంలో a wonderful cure has been done with diasphoria for a patient having great gastric trouble, vomiting, not eating for the past 2 months. The doctor asked him to live on gruyere. అన్నప్పటికీ మధ్య కలుపు శుభ్రం కాదు. పొద్దున మధ్య ఇప్పుడు కావాలి ఇదిగా రాదు. పచ్చిపోతున్నాడు. He was understood and he has become thin and lean, emaciated. And he was sent from the wonderful fellows of the government hospital. He was there for 4 months. First in the capacity of an outpatient, then in the capacity of inpatient. Then the nurses with him became inpatient. And one of the nurses who had been cured of her menstrual colic in our dispensary has heard him say, "You fool, you go away from this hospital, get yourself discharged and try homeopathy with the WPC dispensary." Because at present, 2/3 of the TTH hospital of Visakhapatnam because the menial staff are using only our homeopathic dispensary drugs as our friend knows. Only the high officers and doctors are destined not to use them. And the fellow of an old nurse sent him out and he kicked him out saying, "You will die if you stay here." Then the fellow said, "Our people are taking guest taking or Buddhi and other doctors. Yes, how the pain is, how you feel the burning, and how it comes here, how the acidity comes here, under what circumstances, during what hours and all that." The fellow was not class exam, and he was thrice or 4 times I saw him doing like this. Then I asked him this to stop. I asked him, "What is it?" He said, "I feel better. I feel better by being like a lot." I feel better. I asked him, "Now are you suffering?" He said, "Yes, I am having pain. So whenever I have the pain and burning, I feel better by sitting like this." Then I asked my fellows to bring one dose of diaspora. The fellows gleamed at me because there will be some doubt that I am getting old. And sometimes my most close disciples like our Jagannath Prabhu may think that master is getting old sometimes, so we did not care. But they brought it and I gave him one dose to just test it. Within 5 minutes the fellow said, the pain and burning subsided. Partially subsided. Within another 5 minutes, completely subsided. I asked him, what was the probable duration in the fast when the pain comes before it subsides? He said, it may be 2 hours or 3 hours. And many times I get it twice or thrice in the day. I asked him, is this the first time for you to get the pain suffers within 5 minutes? He said, yes. He said, definitely yes. And then I suspected that he may be having the similarities and the totality of their story. Then I have given a good support, moral support, and asked him to come tomorrow to take the medicine from me. Tomorrow he said, he came and said, no relief sir, it's the same. Then my boy asked her, Mega asked her, Buddhi asked her, what did you take yesterday? He said, in the night, I took rice with buttermilk. Then previously he asked her, no, I was on Guya. Then he asked him, why did you take rice? He said, I felt like taking it, but I won't take it. Then my boy asked her, after how long time or interval you won't take? He said, after 3 hours. That means definitely the drug is working, he is better. And the next day, he said, he was milk and rice in the morning. He was about to vomit, and there was acid, he didn't vomit. The next day, my son said, you try chapati. He tried chapati and he vomited. He said, no, that's too bad, I can't try chapati. The next day, my boy said, you try chapati again. He said, no chapati. Then my boy asked her, where did you try? He said, in the hotel. So it must be a damn chapati prepared by something like crude oil. You know how it stinks and smells. Then my boy asked him to sit down. And he went inside and informed his sister and his wife to prepare one or two chapati. They prepared. And he asked him to take chapati. The fellow was damn afraid of chapati on one side and this fellow on the other side. He ate the chapati, he did not. It was the fault of the eye, not the fellow. And the next day, gradually within 1 week, my son asked him to try a little alapasari in buttermilk rice. That is gingivala, chutney. You know chutney? And after 2 weeks, there is a recurrence. So we are not yet sure if the drug is indicated to him or not, or giving partial recovery. Then my son gave him second dose of diaspora of 3 weeks. Then there was an interval of 4 weeks to be. Then again he repeated. Then 3 months to be. Then again he wanted, when the fellow repeated, his potency of 1,000. And practically the person was cured with 3 doses of 200 and 1 dose of 100 diaspora. And if you go to any homeopath and say, We cure gastric ulcer with diaspora. He says you are a fool. Because nowhere under the symptoms and diseases it is written that gastric ulcer is cured by diaspora. Because we don't approach homeopathy and homeopathy today. But if we approach, any drug can cure any disease. But because what we call disease is not disease but a suffering. So you have to find out these things as modalities. You will be able to pick up these things. Till today, it is a wonder to me how the fellow was cured with diascoria, even though I know homeopathy. Because it was most improbable to remember diascoria when there is gastric ulcer. But just for fun, I wanted to try. If we apply Hahnemann totally, what happens? I tried. So it was a success. There were many occasions like that. Even in Hyderabad dispensaries also, there were many such wonderful things which they themselves wondered by applying Hahnemann directly without listening to the pathological names of diseases. 200, simple 200. When the drug is well indicated, when the patient is not having any mental symptoms, only physical suffering, except a sickly feeling, he was healthy, he was not having any mental symptoms. So we used only 200. And then, since the disease was too deep, he wanted a single dose of the next dilution. Yes, continue please. Ask him how he responds to heat and cold, to the fan and the light and the variations of the climate. Full stop. Try to find out any seasonal recurrence of certain complaints. Like this, get a complete description of each item of suffering so that you may understand one full attack of the suffering. One full attack of the suffering. అంటే మొత్తం అటాక్ వచ్చినప్పుడు ఎలా స్టార్ట్ అవుతుందో, ఎలా డెవలప్ అవుతుందో, ఎలా కంక్లూడ్ అవుతుందో ఈ మొత్తం పిక్చర్ మీకు వస్తుంది ఇలా చేస్తే. యూ విల్ అండర్స్టాండ్ వన్ పారాగ్రాఫ్ టోటల్, హౌ ఇట్ స్టార్ట్స్, హౌ ఇట్ ఇంక్రీజెస్, హౌ ఇట్ సబ్సైడ్స్, లైక్ దట్. నెక్స్ట్ పాయింట్, do not put direct questions which can be answered yes or no. Which can be answered yes or no. కొంత తీసేస్తాయి. నీకు ఎప్పుడో గడుపులకు వస్తుందా అంటే ఎప్పుడున్నా రాకుండా ఎట్లా ఉంటుంది? రాంగ్ ఇన్ఫర్మేషన్ యువర్ వీడియోస్ ఇటు రాంగ్ ఛానల్స్. It is not okay in the past. It says either yes or no. Both are incorrect. మనకి చివరికి పిక్చర్ రాంగ్ గా వచ్చేటప్పుడు మనకి ఎస్ నో అనుకోలేదు ఎంత చేసింది నీకు కడుపు నొప్పి వస్తే ఇలాగా దిండు పెట్టి నొక్కుకుంటే బాగుంటుంది కదా అని అడగకూడదు పాపం అండి. అడిగితే మరి బాగుంటుందండి అంటాడు విశాఖపట్నంలో. విశాఖపట్నం అడిగితే ఎందుకు బాగుంటుందండి, నొప్పి పెడితే నొక్కుంటే బాగుంటుంది ఏంటండి, హాయ్ బాబు అంటాడు. సో యూ విల్ బి డిసీవ్డ్. యూ హ్యావ్ డిసీవ్డ్ ది పేషెంట్ ఫస్ట్ అండ్ డిసీవ్డ్ యువర్ సెల్ఫ్ నెక్స్ట్. దట్ ఈస్ ది ప్రాసెస్. బై పుట్టింగ్ హిమ్ ఎ లీడింగ్ క్వశ్చన్. జ్వరం వస్తే చలేస్తుందిట్రా అని అడిగితే మరి జ్వరం వస్తే చలేది ఏంటండి అంటాడు వాడు. వస్తూ వాడికి వేస్తుందో ఏదో చస్తే చెప్పడం. వాడి క్వశ్చన్ వేసే పద్ధతి తెలియాలన్నమాట. మనం వాడంతా వాడేది ఆ పాయింట్ మనకి చెప్పినప్పుడు వస్తుందో రాదో కరెక్ట్గా చెబుతాడు. మనం ఇండ్యూస్ చేసినప్పుడు కంగారు పడి ఏదో ఒకటి చెప్పాలి బాగుండదని చెప్పిస్తాడు. అది జాగ్రత్తగా ఉండాలి. అందుకని డైరెక్ట్ క్వశ్చన్స్ వేయబెట్టుకున్నాడు. ఆర్టిస్ట్ చూడండి, పోర్ట్రేట్ వేసేప్పుడు ఎదురుకుండా కూర్చోబెట్టుకుని వేయడు, కొంచెం పక్కగా కూర్చోబెట్టు చచ్చిపోతాడు. ఎదురుకుండా కూర్చోబెట్టుకుని వేయాలంటే ఆ మోస్తరుగా ప్రొఫైల్ తీయాలి 2-3 యాంగిల్స్. అప్పుడు మీకు ఫ్రంట్ పిక్చర్ ఆటోమేటిక్గా వస్తుంది. వీటి దగ్గర కూడా అంతే. నెక్స్ట్ పాయింట్, do not ask leading questions or questions that suggest an answer to him. వాడికి అంటే లేని ఆన్సర్ వాడి బుర్రకి సజెస్ట్ అవుతుంది. వాడు ఆథర్లాగా ఆ కాసేపు పనిచేస్తాడు అన్నాడు. కొత్త పుస్తకం రాసినట్టు, కథ రాసినట్టు అది చెప్పేస్తాడు. వాడు మీరు అడిగితే, క్వశ్చన్ అడిగితే, లీడింగ్ క్వశ్చన్స్ అడిగినప్పుడు సపోజ్ మీరు శ్రీశైలం వెళ్ళారనుకోండి అని అడుగుతారు వాడిని. విశాఖపట్నంలో ఉన్నవాడిని అంటే శ్రీశైలం అండి అది ఎక్కడే వాడు పాపం వాడికి తెలియదు అసలు. అంటే కొండ మీద ఉంటుందిరా, చాలా చలేస్తుంది, అడవి అది ఉంటుంది అంటే జబ్బు చేస్తుందండి, నాకు జ్వరం వచ్చేస్తుందండి అంటే కొండ అడవి ఇవన్నీ ఉన్నాయి, అక్కడ చలిగా ఉంటుంది అంటే అయ్యి బాబు అనిపిస్తుంది, అక్కడ చేస్తే జబ్బు చేస్తుంది అనిపిస్తుంది అన్నమాట. మనం వాడికి మ్యాటర్ ఇచ్చి వాడిని షార్ట్ స్టోరీ రాయమంటున్నాం, మనకి రాయటానికి బతకం వేసి వాడు రాసేస్తాడు. లీడింగ్ క్వశ్చన్స్ చేయడానికి జాగ్రత్త చేస్తున్నాడు. కడుపు నొప్పి వచ్చినప్పుడు ఈ వేడి నీళ్ళ బాటిల్ పెట్టుకుంటే బాగుంటుంది కాదు, ఎడ్యుకేటెడ్ పీపుల్కి కూడా బాగుంటుంది అనిపిస్తుంది. కడుపు నొప్పి వచ్చినప్పుడు వాళ్ళకి జ్ఞాపకం ఉంటుంది, కానీ రానప్పుడు మీకు వేడి నీళ్ళ బాటిల్ పెట్టుకుంటే బాగుంటుందా అని అడిగితే బాగుంటుంది. కామన్ సెన్స్ పాయింట్ బాగుండకే అనిపిస్తుంది. ఇక్కడ కావాల్సింది కామన్ సెన్స్ కాదు, అబ్జర్వేషన్, స్టాటిస్టికల్ పాయింట్. అందుకని కడుపు నొప్పి వచ్చినప్పుడు ఏం చేస్తావు, కొంచెం ఏం చేస్తే సదుపాయంగా ఉంటుందంటే జ్ఞాపకం ఉందని చెబుతాడు వాడు. చెప్పినవి కరెక్ట్గా ఉంటాయి. ఇలాగే మనకు క్వశ్చన్. అనదర్ పాయింట్, ట్రై టు గో ఇన్ టు ది ప్రొఫెషనల్ మ్యాటర్స్ అండ్ ది సోషల్ డొమెస్టిక్ relationships with others at home and abroad. If you suspect any psychological causes that might have stimulated his sora, into a horrible disease. Now, this is the place where you have to test your moral sense and integrity. You have to go into the very intricate detail of certain secrets of a person to try to cure him, but any prying nature in you will make you an unpardonable sinner. That is, for curiosity, if you want to know certain things about patients, you must be a scoundrel. Only when there is a necessity, and as far as there is a necessity, you are expected to go into the family details or official matters which made him worse. And then it is your pious duty to close your mouth with others about him. Unless these two traits are with you, you are not fit by the Creator, created to do any service to humanity. This is one of the points very much asserted by Hippocrates in his vow of Hippocrates. That is, he had his disciples in those days taken oath before him that they would behave like this and like this and like this before they started their treatment. Even today, that vow is taken there, and every student is expected to read it in the convocation, but it is taken as read by the lazy professors and the students in the medical colleges. Because even though it is read only to break. I'll show you how the wording contains after a few days. It is a very, very pious oath called the Oath of Hippocrates. Doctors have to take an oath with it. So, if you know certain things about a patient, you should know only until he is cured. Then you should not know. If you know it, you should forget about it. That's all. Because to stimulate sora sometimes, we have horrible strain and stress upon the mind as the causation. For example, in Bailadila, Madhya Pradesh, there is one very important person who was suffering from an incurable so-called disease. He was treated by many allopathics and homeopathics. I also treated him for about 1.5 years without any results at all. And I went to him and I stopped with him for 3 days. Wonderfully enough, he confided in me and he felt that he could place a confidence in me. And he has revealed certain things about his personal matters. And they gave solution to cure him and he is cured. I never gave any medicine, but I asked him to use medicine like this. I suggested him how to use the remedies. Then he is cured. Like that. And in Bhubaneswar, there is one fine gentleman suffering from continuous indigestion, acidity and gastric trouble for the past 18 years. A challenge case to all doctors, allopathic, homeopathic, ayurvedic, homeopathic, acupuncture or anything on the face of earth. He is like that. And wonderfully enough, when I had been there on my way to Konark, I found he was having 2 big families, one not knowing the other. Each wife having 5 children, one wife, and 4 children, another wife. And the fellow budgeting and maintaining the budget of the 2 different families, living with the 2 families 12 miles apart without allowing the one wife to know of the other family. So, all this stimulated his sora. And he had to eat at his Rukmini, and then when he goes to the house of Satyabhama, that is the 2 famous wives of Lord Krishna, then she prepares, because today is Saraswati Puja, the first wife prepared gares and the second wife prepared payasam. He had to eat like a bull. So, his indigestion cannot be cured. Till today, he is not cured. He suffers and suffers and suffers. And he doesn't find a solution unless he goes to Kashi and becomes a Swamiji. Or a holy departure from this earth planet. Only 2 alternatives. So, anyone asks us to go into the details, but be pious before doing it. Like that. See that one can have confidence in you. That's all. So, 10 minutes recess. For your information, under every drug, there are certain remarks made by Kent. They are very, very important in having an estimate of the drug and the position of the drug in the arena of materia medica. The first remark is, it is a frequently indicated remedy. Frequently indicated remedy. That means you have often the opportunity of getting arsenic album patients. Whenever there are 5 patients at you will find at least 1 patient among 5. That is the probability of arsenic album, both in acute and chronic. So the second sentence is equally indicated in acute and chronic diseases. The third remark is, it is an active medicine producing very active symptoms. Very active symptoms. This appears very simple, but when you understand that whenever a patient is drowsy, sluggish and not active, you can eliminate arsenic album from the picture. See, that is, suppose the symptoms are dull, not violent, and the patient is not anxious. He has an attitude of lassitude. That is, a passive and indifferent way about his own disorder. That means you should never consider arsenic album in his case. In that way, this remark is very important. Another remark, it affects every part of man. Every part of man. That means from headache to toothache to stomachache to earache to nerve pains to stomach pains to sciatica to rheumatism to gastric ulcers to fevers, typhoid, pneumonia, every type of complaint may have arsenic album symptoms and may be cured by it. You see, so you should not shirk suspecting the symptoms of arsenic album in any type of patient. That is the picture of it. And another remark, it affects all the tissues of man. That means now you stop there and listen to me how it affects all the tissues. In typhoid, the intestines and the abdomen are affected. In all the patients of the so-called typhoid fever. But if the patient has restlessness,